Hi, my name is Barb Pierce. In this video, I want to introduce you to tension and trauma releasing exercises, and in a separate video, I will show you the preparatory exercises. First of all, what is TRE? TRE is a way of activating our natural tremoring mechanism to release tension and trauma in a safe way. It was developed by Dr. David Berceli, who is a trauma specialist who worked in war zones around the world, and he noticed that when people tremble or shake after a trauma, they seem to recover quicker. He since developed a way of helping people relearn how to do this. It's similar to how an animal who escapes a predator will lie down and shake, then get up and move on with its lives. We as humans have this capability, but most of us have forgotten how to do it, and you can learn how to do this. This methodology activates neurogenic tremors in your body, and this is involuntary shaking that comes from the nervous system. It's not something that we actually do on purpose from a conscious perspective. We learn ways to allow it to surface on its own. In doing so, it releases deep chronic tension, bracing, and trauma that has been held in the body. If you practice these exercises, it can release tension, relieve anxiety, help you sleep better, and it's a perfect combination to use with talk therapies. It's not for everybody though. If you have significant trauma, I would highly recommend you do it with a qualified practitioner rather than try it on your own. If you are pregnant, I would not recommend this right now. If you've had recent surgery or acute injuries, if you have any uncontrolled conditions, particularly psychiatric conditions as well, I would not recommend doing this on your own. I would also recommend learning basic regulation tools first, like diaphragmatic breathing and other calming breathing techniques. So if you decide to try this, you might notice after the session you are very tired, you're feeling more calm, you're feeling maybe a little bit less anxious, and TRE is cumulative. You're not going to release all your trauma in your first go. Most people start with 2 or 3 sessions in the first week, giving time in between to see how they're impacted by it. They start with shorter sessions as well. As they notice how it's working for their body, they can then perhaps start doing it every day or at a cadence that works best for them. Some people do the TRE exercises in the mornings if they happen to be activating for them. Some people find they get very tired and the perfect time for them to do it is before bed. So please check out my next video on how to actually do the exercises.